Let's talk about then the new dentist coming out, the person that's just graduated out of school. What does the book, The Profitable Practice, have in it for those people?
When a dentist graduates, they have several choices. The first is to perhaps return to postgraduate studies and become a specialist dentist. Some young dentists go straight into a residency at a hospital. They might work 1 to 2 years in a GPR, general residency. Most across North America today will go straight into an associate position, where they would associate with a senior dentist, maybe for 1 to 5 years. Maybe they'll be on an ownership track with that dentist. Maybe they're just there for the experience, knowing they'll be leaving the area or buying or setting up. And then after that 1 to 5 year period of association is complete, most dentists will do one of two things. They will set up a brand new practice, or they will buy a dental practice, either privately or from the owner where they work, or through a broker. And those are the three sources of acquisition. Brokers like myself, through the owner if they're working somewhere, or privately, maybe they know someone who is selling privately. And the setting up of a dental practice is not as attractive as it once was, purely because right now we have an adequate supply of dentists in most of the major centers across North America. All the cities and suburbs are adequately supplied with dentists, so setting up a brand new practice is a pretty risky venture. That's why more and more people are turning to the purchasing of an established business for cash flow. Yes, you get old equipment and you might get that facility that's not as sexy as you might dream of, but you can renovate and you can re-equip. It's that client list that is the precious asset. That is where the growth and value of dental practices has been for the last 25 years. It's likely to continue to grow more. That's a precious asset, is that client list.
Now also, as well, they are able to assume a trained staff sometimes that have been in place, know the clientele, know the business itself. So they're not starting fresh with brand new people. Start a business from scratch is a wonderful venture because it's your design, your colors, your equipment, your policies, your logo, your website. It's fabulous. Sure. Starting from scratch is very exciting. It's like buying a brand new home. But a brand new home has never been lived in and it's not worked out yet. Right. And with this established staff and some of these established practices that come on the market for sale, the average rookie dentist, if you will, with 5 years experience in business or less, it's all done for you. The staff is there. And we all have to assume that a business owner would probably have hired and trained the staff to the best of his or her ability. So if you buy an established practice, it's a given that the owner probably did his or her best up to this point. Maybe I can improve it, maybe I can't. Yeah. But it's done for you so the dentist can do what they do best, treat patients and generate revenue. And when you mention revenue, immediately you're dealing with cash flow. You know what the business is generating when you take it over. I use the analogy very much. When people buy a brand new unit, let's say, that will turn into an investment property, or do they buy an existing investment property that has a current tenant in it, like what we do promote, and you know what your cash flow is the day you purchase, let's say, a property. But in this case, the dentist knows exactly where the numbers sit. So it's not guesswork. It's not that they're begging new clients to come over, because a lot of times, I guess, when you establish a brand new practice, you have to separate the relationship that person has with their current dentist.
Absolutely, absolutely. You're competing for another dentist patients when you start up. Sure, there's new people that move into an area, particularly in a growth area like an expanding suburb, but we don't have the same suburban expansion in North America we had several years ago. New houses are not being built at the same pace. In fact, in some areas, houses are being abandoned. So we have a net patient loss in some areas. So for a dentist to attract new patients, yes, they have to take them away from another dentist. And that's called competition. And they compete on hours and services and fees and a multitude of other aspects. And competition is fierce in some Canadian and North American dental markets. So the buying up of the practice is becoming more and more common only because predictability. And you might find this surprising, and it's in the book. 85 to 95% of patients return to a dental practice when their dentist of record retires or sells or moves on. Most new dentists fear, I will lose all the patients. The staff won't like me. These are unfounded. There's no basis for it, except in a couple of rare instances where horrible mistakes were made, and our book contains many tips on the transition on how to preserve that precious patient list that you've just paid for.